Hi, my name's Georgia from BN Australia, and today we're going to talk about how a pelvic floor wand or vaginal dilators can help with entrance tightness. Now, entrance tightness might happen in the case of vaginismus, Lichens Sclerosis, or postmenopause. There's a few other conditions where it can happen but those are the main ones that we're going to be talking about today. So we're talking about where there's a decrease in size or a decrease in pliability of the skin or the muscles at the entrance of the vagina, which can either cause pain or discomfort with penetration, so using tampons, having intercourse, those sort of things, or it can start to impact on urinary function because it can start to obstruct the urethra. So in those individuals, we really want to start to lengthen and open the pelvic floor. So there's a couple of different ways that we can do that. The first one is with a vaginal dilator. So depending on the opening size and how restricted that muscle or that skin is, we might be starting with size 1 dilator, which is about the size of your pinky. If you can comfortably insert one finger into the vaginal canal, but anything larger than that starts to get uncomfortable, or even movement with one finger is uncomfortable, then I would start with size 3. So what we can do is insert the dilator into the vaginal canal and then leave it in there for a period of time. So that might be 10 minutes, 15 minutes, it depends on your level of tolerance at the start. But if you can tolerate 15 to 20 minutes, that's where we would start. So the dilator is just sitting inside the vaginal canal. You're in a relaxed, reclined position, lying down. Maybe you've got the telly on, you're reading a book, something like that to distract yourself while the dilator is in there. Then you can do some movement at the end, so you might be turning it from side to side, you might be gently removing and reinserting it to mimic penetration, or you might be doing movements going in a clockwise or an anti-clockwise direction to apply a little bit more pressure to the entrance muscles. Once all of those things are comfortable, then you can move on from size 3 to size 4, etc., etc. Some people will need to move all the way to size 8, particularly if penetration with a partner with quite a well-endowed penis or penetrating object is the goal. But if you just need to use tampons or be able to have speculum exams, maintain your bladder capacity, then you might be able to stop at more like size 4, size 5 in the dilators. So that is one technique. You can also do it with a pelvic floor wand. So if it's more that we just need to stretch the base of the entrance of the vagina, or there's quite tight scar tissue or something that's really restricting particularly the base of the entrance of the vagina, the wand can be used to stretch it. So we pop the wand into the entrance of the vagina with a little bit of water-based lubricant or intimate gel, and then we're applying pressure in a 3 o'clock to 6 o'clock direction, and then a 9 o'clock to 6 o'clock direction. So we're kind of going from halfway down to the base and halfway down to the base. By doing that, we're gently tensioning and drawing this entrance muscle down on either side to create a little bit more length through the tissue. What can be really nice to do with that as well is to do an inhale first, exhale, tiny little squeeze of the pelvic floor, and then as you inhale, lengthen the pelvic floor and move the wand. So as you're relaxing that pelvic floor and opening that pelvic floor, we're applying a little bit of downward pressure in order to maximize and extenuate that length that we're getting through the pelvic floor. So an inhale first, exhale, squeeze pelvic floor, inhale, relax pelvic floor and move. Exhale, squeeze. Inhale, pelvic floor wand down, lengthen and relax the pelvic floor. So those are a couple of techniques that you can try to help to lengthen and open the pelvic floor. These work really well when then paired with diaphragmatic breathing, pelvic floor visualization and relaxation, as well as some pelvic floor mobility. But some people really need that direct stimulation and that direct stretch of the vagina as well in order to maintain patency or to stretch and open the vaginal canal. If you want to pair it though with some of those other techniques I just mentioned, you can head to bn.com.au for more information, or on our YouTube channel, there's a bunch of resources there as well.